And we welcome you back to In Focus. And it's time now for our In Focus Health Update with health reporter Linord Moudou.
And she's here to tell us about a group that is working for great access to immunization for poor countries. Yeah.
Hello, Vincent. Hello, Dimiaki. Hello, everyone. The Gavi Alliance is a public-private partnership focused on saving children's lives and increasing access to immunization in poor countries. Launched in 2000, it brings together developing countries, donor governments, and philanthropic organizations. Dagfinn Hoybraten is the former Minister of Health of Norway and Gavi's board chairman. He talks about the organization's work after a decade.
We were able to immunize nearly 300 million children. And we know that more than 5.5 million lives were saved in the course of that first decade of Gavi's history.
Were there some vaccines that were more important than others?
In the first phase of Gavi's existence, we focused on the existing vaccines. The triple vaccine became the pentavalent vaccine. It's now 5 vaccines in one. And the focus was to scale up the use of these underused vaccines. In the second phase, we looked at how can we bring on board new vaccines that were coming. How can we make use of that huge market by strengthening the purchasing power of that market. The idea of Gavi is to pull together all the demand in that market, secure delivery from industry, but also pressure prices down.
What is the role of local governments?
They're all partners of Gavi. We're doing this together, and Gavi's programs are solely country-driven. It's the country demand that is the very bottom of what we're doing, and it's the country health plan that is the very framework of delivery. And then we work with partners on the ground, but also with UNICEF, World Bank, WHO, and our partners in the civil society to reach every child with these fantastic tools that vaccines are. We have these tools, and we know that we can prevent disease and save lives. It's a moral imperative to act.
The board has agreed to release new funding for HBV and rubella. Can you tell us about this new funding that is coming?
Yes, the good part of the story of last year, we went to our donors with this challenge and showed them this is what we can do. We can save 4 million lives if you give us $3.7 billion. When we were given more than $4 billion in the course of a 5-year period. And that makes it possible to open possibilities for financing new vaccines. In addition to the rotavirus and the pneumococcal vaccines I mentioned that as we are speaking, rolling out. And one is the cervical cancer vaccine, HPV.
What are the targets in terms of region or country?
Well, our focus is where the disease burden is, and we direct our support to the poorest countries. But there is no free lunch in Gavi. That means every country, no matter how weak the economy is, needs to co-pay, to contribute to the vaccination program.
So how is that co-pay determined? Is it according to the country's ability to pay, or is there a flat fee?
It's certainly according to the country's ability to pay. It's linked to the gross national product of the country. That means that the poorest country pay a little. When the economy grows, and it does in many developing countries these days, that's also a very good news, then they need to contribute some more. And eventually, when the economy reaches a certain threshold, countries graduate from Gavi. And hopefully this is a way to sustain a continued focus and effort in the vaccination program, in the immunization plan of the country.
Looking at the Millennium Development Goals 4, which is to reduce child mortality, and also 5, to improve maternal health, are you optimistic with regards to achieving the goal?
It's not possible to achieve the MDG 4 and 5, especially the one concerning child mortality, without a strong effort to raise the level of vaccination and to introduce these new vaccines that can really prevent diseases. But the good news is that we have the tools, we have the interventions, we have the vaccines, and we have mobilized resources. So in the course of the next 5 years, up to 2015, which is the moment of truth when it comes to the Millennium Goals, Gavi is going to be able, through its partners, to deliver a substantial part of reaching those goals.
In 2015, how would you evaluate success with Gavi Alliance?
We know that if we fulfill the program that is now being funded and organized, we'll save 4 million children's lives. And those 4 million children, they are single individuals. They can contribute to the economic development and growth of their country, and they can be great leaders in the future. And if we can contribute to save each and every one of those 4 million, we have really changed the world to a better place.
And with the new funding, Gavi Alliance estimates that by 2015, up to 2 million women and girls will be protected against cervical cancer, and approximately 600 million children in 30 countries will be immunized with a combined measles rubella vaccine. Vincent Timiake, that's all for today.
Thank you very much.
Thank you so much, Linord,
for those updates.
So informative.
And be sure to watch for Linord Moudou's health updates every Tuesday and Thursday right here on In Focus.